Hi, everybody. My name is Dr. Devin Shea from Aligned Life Chiropractic and Wellness, and I just wanted to share some really exciting information on a case that I just presented at the Chiropractic Biophysics annual conference out in Tucson, Arizona. I had a number of you asking about what the case was all about and maybe looking a little bit more into the details behind how we go about working up a case, what we would do to identify what's wrong, how we go about correcting those issues, and then what are some of the results that we're getting. And I think that this does a really great job of being able to illustrate all of those things. So I will try the best that I can not to use any jargon that's associated with some of these things. But I think it's also cool for you guys to get a really true understanding of what it's all about, to go through and figure out some of the nuances of these spinal correction cases. So this is the case that we started. Actually, first, let me tell you a little bit about our clinic. So Align Life Chiropractic and Wellness was started in 2008. And you can see some pictures here. We're located in San Diego, California. At the time of this recording, we have been doing really just corrective care only in our office. And corrective care can mean a lot of things in the wellness world, but really what I mean by this is we want to look at the spine from a structural perspective and try to, for each individual, correct the problems that they face by working to get their spine to their individual ideal spine position. And remember that not only does this corrective process improve the life of the spine, meaning reducing susceptibility for degenerative disc disease, degenerative joint disease, but it also makes sure that how the spine goes about protecting the spinal cord that passes through the spine and the nerve roots that leave the spine going out into all parts of the body. It really ensures that we have optimal function of that nervous system to make sure that we can communicate effectively between the brain and the body so that we can heal at 100% and functional optimally for as long as possible. So this has considerable implications in the way that your body is going to function overall for your whole life. So I get fired up about talking about this work because it's just such a huge and profound impact on the way that people operate. So here's a couple of pictures of our clinic. We have digital x-ray, we have a functional rehab space, we have an adjusting space, and we have some traction areas. The traction tables you'll see on the right-hand side of the screen, there are 4 Dental tables, a couple of Myers wall units, a few Pope two-ways. These correct the spine not only in the front to back view of looking at someone's posture, but also when we look at their body from the side view as well. I am also a big proponent of functional rehabilitation. That means exercises for stretching, strengthening, and for posture. We create all of these specifically for each individual. There is no cookie cutter approach to the way that we work with the spine and the posture. We take x-rays in-house. We also include other types of therapy, including massage therapy, acupuncture, and so forth. We have that all in-house. And all the cool part about it is all of our team communicate with one another to be able to help each other do everything that we can to be able to improve the patient outcomes. So communication between the providers is a big underlying core value of Aligned Life. So let's talk a little bit about the case. This is a gentleman, he was 44. He was referred in off of a Yelp review. If you look at our Yelp reviews, we have more 5-star Yelp reviews in our area than any other practice by a long shot. And so this gentleman looked at our reviews and said, oh, this looks like something that I want to go and check out. He had, at the beginning of his case, sharp neck pain with range of motion loss. So he was really restricted in his ability to get into those full ranges. Dull, constant pain in the middle back and stiffness through the mid back. And he had previous bouts of lower back pain that had gotten very severe. He had a trauma history of, in 2013, he had a motor vehicle crash where he was rear-ended. And his postural history, which is one of those ones that we look at extensively, and you'll see how we address this here in just a moment. He was driving to and from job sites. His job, he owns a garage repair and installation business and has done that for many years. And so he spends a lot of time working on the computer, creating bids for these jobs. And then he would drive to the site, and his job is very physical, as you can imagine, up and down ladders, hanging these heavy pieces and so forth. And the garage repair is challenging on his physical body. So he came to us with goals of improving his flexibility of his spine because he felt like he was very stiff and it was progressively getting worse over time. And the key part that's kind of interesting is he really wanted to be able to tolerate stress of owning his own business. As someone who's owned their own business, in fact, multiple businesses, this is a really big issue for entrepreneurs, people who have a high stress job. They need to get to a place where they feel like their health is stable. And he felt like it was a really erratic. He'd have good days and then really bad days, days where he literally couldn't do his job. So not only was impacting his company, but also then his family and his income and then his mental health on top of that. And then at the end of all of this, which I thought was really cool, is this guy really wanted to be the physical example and mentor how to be healthy for his children. He's got two beautiful children. We've begun taking care of them as well as his wife in the practice after doing so well with his case. And we kind of see that happen all the time. We typically get one person that's sort of the guinea pig that comes in. As long as they get a great result, and then everybody starts coming in, and we really appreciate the referrals and enjoy really working with a family, because then we really created a culture of how to be healthy for the entire family in the practice and in their home life and the way that they do things. And it's really rewarding. So this was kind of a great example of how this ended up happening. So this is where this gentleman started out in his health journey. These were some postural photos. So one thing that we do at the very beginning is on the first visit, we take some pictures of someone's posture, looking at them from the front to back and from the side. And you'll notice for everything today, guys, the green line is going to represent the ideal position of the body for that posture, for that individual. And then the red lines represent the body's current position at the time of the photo. So you'll see in the front to back version of his posture, this gentleman was sitting way off axis to his left-hand side, not only in the pelvis, but the torso, and then his head was trying to compensate, coming back towards center line. And then when we looked at the body from the side view, his pelvis is forward in relationship to his ankle bone. Then his torso is kicked way back, and then his head is then drawn forward to be able to keep eyes to the horizon to maintain that riding reflex. And this posture is something that we see all the time. In fact, our younger generation is now expressing this type of postural fault at a higher and higher prevalence every single year. I think it's because cell phones and laptops and doing school from home, and then also just the social aspect of playing games and gaming with our friends and so forth, and Snapchat and social media. We just spend so much time in this forward flex position. So we're getting really good at correcting these types of things, and we're having to do it at an earlier and earlier age. So this gentleman, this is how he began posturally with this. We checked his initial range of motion, and I palpated his spine. Again, this is something that we do with every single new patient. We found that he had tenderness to palpation at L5, which is the bottom vertebra in his lower back, a couple segments in his middle back and his thoracic spine, and really his entire right-hand side of his neck was sore and tender and had range of motion loss throughout his spine. We took some initial x-rays, and these are great examples. These are not x-rays that we only do for this individual. These are x-rays that we do for every single person that comes into the clinic. We take a full spine front to back view, and we take a full spine lateral. And we're able to get really interesting data that gives us a really great understanding of where is the person's spine now, what needs to change in order for them to be able to get a great result, and then what are some of our goals. And so really, when I look at these pictures, you'll notice in the front to back version of the posture, we have the body sitting off axis, really starting right around at the transition between his mid and lower back and staying consistent all the way up till he's got about 8 millimeters of off axis translation to his left-hand side. And then we look at his spine from the side view. This gentleman presented with too much curve in his middle back. Remember, curves in the spine in the side view are what we want. We want to have each of these curves be approximately the same amount of angle. And in this case, this gentleman presented with about 23 degrees, or 23% more curve in his mid back, and then considerably a lost cervical curve. His neck curve is way too straight. If you look at that, it's very, very straight up and down in his neck. Only 7 degrees of curve in the neck, which is about 80–90% loss of the normal curve. Now, things that we typically see when we get that loss of cervical curve is, one, premature degenerative change, like degenerative disc disease and degenerative joint disease. We also see things like headache, migraine, radiating arm pain, down numbness, tingling, burning, weakness, and coldness, as well as neck pain and upper back pain. This gentleman had many of those symptoms as we began. So one of the things we try to do in the beginning of working with someone is identify where are they now, and then more importantly, based upon a few, we call it morphology um, predictive statistics, we can understand how much change we can expect to make with working with this individual. And so, like I talked about already, this gentleman had loss of the neck curve and too much curve in the mid back. And so those numbers are seen in red there. So we said, okay, this is the area that we really want to put all of our corrective emphasis towards. So our diagnosis and treatment plan for this individual, his diagnosis was cervical hypolordosis, meaning loss of curve, thoracic hyperkyphosis, meaning too much curve, and then we had a couple of postural changes where he was shifted off axis. We recommended 12 weeks of care. We were going to be doing some adjustments initially to try to get rid of his pain, restore his function, get his range of motion back, and then after that, we were going to be really working on just getting his posture to improve. So we gave him functional and postural exercises. We gave him home traction so that he can work on things at home from a structural perspective. And then we also gave him in-office tractioning. Guys, keep in mind, traction is very similar to like when you go to an orthodontist with crooked teeth. They put the braces on there to be able to improve the alignment of the teeth. And then all of a sudden, after a period of time, they take the braces off. Things are in a better position. The jaw works better. Our teeth and the way that we talk works better. Our susceptibility to things like cavities and so forth is reduced, and all of those same types of changes happen with the spine. But we see that it's an overall health change because not only does the spine hold up better over time, so we function optimally later in life, but it impacts our nervous system. So it improves our overall health because the brain and the body are now communicating at 100%, which makes all the difference. The last thing that we included for this individual was we gave him some lifestyle postural coaching, which I find there's so much gold to be mined in this conversation. I'll show you how we do that in just a second. So when we began the treatment plan, you can see some of the types of adjustments that we do, hands-on and instrument adjusting. The pictures on the left-hand side are our functional adjustments. The pictures on the right-hand side of the screen, this is all our mirror image adjusting. We put somebody in the opposite position of their current posture, and then we stimulate the nervous system and the spine to be able to help the body take on these new patterns that we want to reinforce, getting them out of the old posture and into the new posture, and reminding this over and over and over again until this just becomes the new pattern for the individual. We also gave them postural exercises. You can see examples of what we did for this individual, putting them in the exact opposite position of their current position. We gave them some functional exercises. Again, this is an individual that has a very physical job and was spending a lot of time in the car and in front of the computer. So we gave him things to be able to stabilize his spine, whether he was on the job site or behind the desk. We also gave him in-office traction. You can see the examples of putting this patient into the opposite position of his current posture. We start off at 3 minutes of traction. We progressively increase the time frame only to the patient's tolerance for these traction positions. This gentleman did a fantastic job of being able to tolerate that. And then the far picture, which has one of my office colleagues in there, we show exactly what it looks like when this person was using their home traction orthotic. The home traction orthotic is the white block that you'll see underneath this gentleman's neck. What this does is it reminds the neck position to be able to add curve into the neck while reducing forward head posture. A similar approach is taken where we start them off at 3 minutes, we progress up to a 20-minute time frame to the patient's tolerance throughout the corrective time frame. So let's talk about some results. When we redid this gentleman's evaluation almost 3 months to the day later, you can see a massive difference in his postural photos. In the front to back plane, this gentleman went from total deviation of 2.88 inches in total distortion all the way down to just 0.87 inches of postural distortion. Essentially, this gentleman went from outside the normal range of posture all the way into the normal range and has a little bit of a buffer to go there, which is even better. We also saw that the amount of rotation in his spine and posture went from 5.3 degrees down to 2.3 degrees. So things looking much, much more normal. From the side view, this gentleman went from a 5-inch total deviation, which is way outside the normal range, all the way down to a 1.9, which is very much in the normal range. So thinking and looking really, really good after his care. One of the things that our office does that I really feel like separates us even further from what most chiropractic clinics do is we take a look at people's postural habits. And this gentleman did a fantastic job. We call this a postural habit evaluation. We have people take pictures of their body in relationship to all of their workspaces outside the office. So We talked about earlier how this gentleman spent a lot of time in front of the computer. So we had him take pictures of what his body position looks like in front of the computer. We had him take pictures in the car. He's at the couch, spending time with his family. And then what we do is we review these pictures with each patient and we write out action steps of what needs to be changed about their environment, whether these are ergonomic changes just with their postural habits, or whether we actually need to get new things. Maybe it's a standing desk. Maybe it's we need to get a wireless keyboard and mouse if the person's using a laptop. Maybe it's they need to change their car position, bring the seat up, bring the steering wheel closer. All of these changes really go into customization of getting the environment to match the individual. And what I find is this really limits stress to the structural aspect of our body and allows people to heal, not for the short term, although it's very effective in the short term, but the key part is it really allows them to heal in the long run. And so this part gets me really fired up. We get an action step list, we screenshot this, we send it home with the patient, they implement, and then they can do multiple rounds of those pictures until we get everything absolutely perfect. And I think a lot of that work that's done on the back end by the patient in conjunction with the adjustments, the exercises, the tractioning, and so forth really helps to be able to make these changes a reality. So the next thing that we did is we took some x-rays of this patient pre and post. These are the picture on the left is the initial x-ray in September of 23. The picture on the right is the post x-ray that's taken 3 months later. An incredible change in the neck. We went from a 7-degree curve up to a 31-degree curve, way, way better. And his mid-back went down from 54 degrees, too much curve in the mid-back, and really now down to 37 degrees, much more consistent. Each of the areas of the spine being at about a 30-degree curve, which is exactly what this individual needed. So I love seeing this change. This is exactly what we were looking for. And then we also did the front to back view, and you can just see an 8 millimeter off-axis translation down to a 1.7 millimeter off-axis translation for the total position, spine lining up almost perfectly, which is exactly what we were expecting with this gentleman. Now, his morphology, which means the anatomy that his body presented with now matches his posture. When your spine and your posture match, what we typically see is that people's health massively improve. And what we did is we did what's called an SF-36. This is a test that has many, many questions, 36 questions, and it looks at how someone did initially, and then at the end of their care. We give them the test at the beginning, we give them the test at the end of their 3-month corrective time frame. And it looks at really someone's overall health impact from the care. So their physical functioning, 8 to 95, their role functioning, their physiology. He was started out as a 0. He was really concerned that he wasn't going to be able to provide his role physically in his life. And after care, he was at 100%. That's huge. His energy went up, which for an entrepreneur to go from a 65 to an 80, a 15 point difference, that's massive. That's game changing. Their social functioning, how they interacted, because this guy was in pain. He had loss of function. He wasn't able to be involved with his family as much as he wanted, or with his friends as much as he wanted. Pain went from a 22 to a 77, and his overall general health from 70 to 85. What's really cool then is we did a 6-month follow-up with this. So after corrective care, which is in December of 23, we did a 6-month follow-up with this gentleman again in May of 2024. And all we did is we saw this person 1 time per month after that corrective window. So we were seeing him 36 visits over 3 months. And then we backed way off to once a month. And what's incredible is this person progressively got better, even though we were seeing them less, because what we notice in the research is once we make a good corrective change in the spine, the body will desire to stay in the upright position once we make that change. And you can really see at his most recent photos, the posture was the best that we've ever seen it, not only in the front to back and in the lateral planes, but then better yet, we did the SF-36 score again. We had him take the test 1 more time. So initial, then post-corrective, and then at the 6-month follow-up. And you can see it, all of his numbers are up over 90%. In fact, most of them are at 100% resolve. So This is an incredible outcome for this individual, not only impacting his quality of life, his function, his pain levels, but really just his general quality of what we expect for this individual moving forward. We have him on a once-a-month visit. He keeps up with his home traction orthotic and exercises at home, but really this is sort of blends into the background of his life because he's done such a great job throughout. So guys, I hope this really gives you an understanding of the types of work that we do. I just want to drive home that this is not different from what we do with everybody. We didn't just say, oh, we're going to be presenting this case at the annual conference. Let's really beef this up and do it differently. This is every single person that walks in the door. So if you're looking for this in-depth analysis and the types of things that we're implementing with people and the correction that this individual is being able to achieve, this is something that's possible potentially for you. So if you're interested in having an evaluation done just like this individual with a consultation with me, an examination, postural photos, x-rays, and so forth, then please call the office. Our phone number is 858-521-8022, or check out some information on our website, alignedlifewellness.com. We would love to be able to help you out in any way that you feel it is necessary. Thanks so much for checking out what we're doing, and I'll look forward to meeting you in person. Take care. Have a great day.